Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls at 866-870-5752 right here in the studio. And right now, Dr. Darrow is speaking with Lewis in Los Angeles.
Hey, Lewis, we got a bunch of callers to go to now, but I want to thank you so much for your call, and hopefully I can help your son's back by just simple injections of PRP. And it's real easy. Just draw the blood, spin it, and inject the platelets. PRP is platelet-rich plasma. If it was something on the more extreme side, we may want to use stem cells with it. But I need to examine him. Anything you tell me, he's got bone spurs or whatever it is, herniated discs, I don't care, means nothing. We have to do the examination, find out where the pain is coming from. So God bless you, Lewis. We're going to go to Diggy right now. And is it Diggy? D-I-G-E-Y?
Digby.
Digi?
Digby.
Digby. Okay.
Digby,
I know you, Digby. You're the big guy, right?
I know you too.
I haven't seen you for a long
time.
I haven't seen you for a long time. Where you been?
Well, I've been hiding. I've just been working like a maniac. But
are you in construction?
Say it again?
Are you in construction?
Yes, plumbing. I'm actually on my way to a plumbing. I'm on my way to a plumbing emergency right now.
Oh my God! Oh my goodness!
I heard your radio show, and I wanted to call because the guy was asking about bone spurs, and I had the bone spur on my right heel.
Yeah.
And I don't know if people are going to think that you're paying me to say this, but I'm not. You're not. I could barely walk at the end of the day. I couldn't sleep. I couldn't put my heel on the bed. And I went to two podiatrists, and both of them said I needed surgery. A buddy of mine recommended me to you. I went to you, and you said, you don't need surgery. Let me start with some shots. And we did it, and I took 4 shots, and I'm like new. It's unbelievable.
I love it.
And I just wanted to say thank you.
And you're a big dude, right? What are you weighing in at, if you don't mind saying?
I'm 6'2", 250 pounds.
Right. So a lot of that problem, just to help educate people, is because you are a big guy.
And I lost weight. Doc told me I was fat, and I lost weight. So I went from 270 to 250 right now. I'm trying to get down to 240. And you know what you also told me? You also told me I was a very handsome guy.
Ah, you are.
Yeah, Doc, I just wanted to call, and I wanted to say thank you.
That's so sweet, Digby.
If you're going to go get surgery, go to Dr. Darrow first, get his opinion, and I have nothing but respect for you, and you did wonders for me, and I want to say thank you, and I mean that from the bottom of my heart.
Oh, that's so sweet. I appreciate it. You always were a nice guy, and now you're even a nicer guy. And Digby, you've got my personal cell number. Anything you need, you call me up, man.
I know that, and I appreciate it. Thank you very much, Doc.
All right, say hi to your wife too.
Thank you, Digby.
You're welcome. Bye-bye.
So I saw Digby, I don't remember when, like 6-9 months ago or something like that. And he is a big dude, really big dude, and very happy-go-lucky, miserable beyond anything. I mean, he's a plumber. He could barely move around. And I guess from what he said today, he's all back healed up and plumbing away as he
apparently on a Saturday, a holiday weekend, and all that stuff.
Well, that's what a good plumber is about, emergencies. All right, so I'm going to give out the phone number before we get to Omar. You hang there, Omar. I know you got knee issues. The phone number to call me right now live, and if you do so, I'm going to mail you for free postage, free book, a copy of a book on how to heal without surgery. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a couple 100-page book with about 250 studies on how regenerative medicine of platelets and stem cells can help heal you without surgery, and how surgery can hurt you. I wish surgery didn't hurt anybody. If that was the case, I would be doing it right now. I was in training in orthopedic surgery until my boss did my shoulder, and I don't blame him, but it didn't turn out good. And I was in misery for a few years until I self-injected myself and healed it overnight. It doesn't happen for everybody. I'm not trying to make myself out to be the shining example of what can happen to you. Well, it can happen to you, but it's not as common as doing more than one treatment. So, Omar, you've got knees. What's up, and how long has it been there?
Good morning, Doc. How are you doing this morning?
I'm living it up.
Doc, I just by chance came across your channel, and I have to say that I'm very, very impressed. And, I wanted to ask you a couple of questions, one on behalf of my mom and one on behalf of myself.
Okay.
My mom is pretty elderly. She's using the walker. Doctors have told her she's basically bone on bone.
Okay.
She's had a couple of injections, Durolane, and also cortisone.
Oh, my God,
She doesn't have any pain.
Oh, that's
She has
good.
no pain right now.
Good.
But she wants to do surgery. She's convinced to do surgery, that surgery is the answer to everything.
Sure.
And I wanted to get your professional opinion as to what your thoughts are on that.
Okay, first of all, what is her age?
78. But she's
Okay.
very weak. She was hospitalized due to pneumonia, and she had all kinds of health issues.
Okay. So, number one, as we age, we don't do as well in surgery. So that's number one. So,
Correct.
in my book, first of all, you just said she doesn't have pain, so I don't even know why she would think about surgery. Does that make any
She thinks
sense?
the surgery somehow is going to enable her to walk upright and get rid of her scoliosis, and she'll have like brand new knees and be able to walk without walker, and
Well, you see,
like
that's
that. And I'm telling her
that's
not
what
gonna be the case.
that's the culture of medicine in our country. Other countries aren't like that. If she was living in, let's say, Sweden, they would never think of doing it. I don't think they'd ever think of doing a back surgery on her or a knee surgery like that.
Right.
They'd say, you're doing fine, go home, because the chance of hurting you is way too high. So I'm not for surgery. If you come to me, don't think about surgery, because I'm going to tell you not to do it.
Right.
And this is a case,
Right.
from what you're telling me, there's no way.
Right. So I will continue to convey your message to her. The second question that I have is about myself, Doc.
Sure.
Just pre-COVID, I was 250 pounds, and I used to be an athlete before that, but I kind of let myself go. The life got in the way. But then afterwards, since the pandemic, I have lost about 50 pounds.
Are you about 200 now?
Now.
How much are you?
Yes, 200.
Okay.
200 pounds.
Good.
5'11".
Good.
And I've become a very avid runner. So
Okay.
I'm running like half marathons and 15K races, and I've really got
Sure.
involved in the community.
Nice.
Some of my friends are telling me I should stop running because that's the worst thing I can do to my knees, and my knees are going to have major problems.
Well, look,
And,
I'm 70.
all
I'm
the
75 years old. I've been running my entire life.
Right.
So,
So
what
I
your
just
friends?
wanted to ask you: is this kind of a complete BS? Should I just stop running because?
Well, do you have any
my
knee
knees are gonna
pain?
give out?
Do you have any knee pain?
I have very minor knee pain, Doc. Very minor knee pain, and I've been doing knee exercises and heel raises and stuff like that.
Sure.
And for the majority, I feel pretty pain-free and feel good about my knees.
Well, I wouldn't have you stop running. If you start getting pain, you might cut back. One of the most important things is if you're starting to get pain anywhere in the body, don't do the same exercise 2 days in a row. Shift it around to something else. Give it a chance to mellow out.
Do you recommend long distance endurance running, which takes?
I
a lot of
recommend
counting?
whatever makes you happy.
Right, running makes me happy. So
Well, then do it.
I feel very good about it.
You know what I'd like you to do? Write this down. There's a Navy SEAL named David Goggins, Goggins.
Yes, I've heard of him. Yes.
He wrote a book called Can't Hurt Me. He's all over social media. He's very famous now. And he was a young man at 300 pounds and really no life that he liked. And he was an exterminator and he hated the bugs and blah, blah, blah. And this is in his book, by the way. And then I never met him.
He's yeah.
And
He's
he
a
just
beast.
decided
He's a
decided to clean up his life. He became a Navy SEAL, and he does races through the mountains for days at a time. I'm not sure if this is true. I heard he had a heart attack on a race, and they took him to the hospital, and he checked himself out and went back to the race. I don't know if that's a story or if that's real, but he doesn't let anything get in his way.
Yeah,
And
yeah. Just off the subject, Doc, what are also your thoughts about, they're saying that long endurance running can be bad for your heart.
No.
You
No.
could have cardiovascular problems
No.
down the road if you exert
No.
that kind of pressure on your heart for
No.
long periods of time.
Nope, haven't seen it. You can have problems with your heart without getting off the couch.
Great.
So here's
So I'm 55 years old, and I think I'm going to continue running and just be careful, like you said. If I have shin splints or knees,
I can get rid of all that. I can get rid of all that stuff for you. Shin splints are a piece of cake to get rid of. Knee pain is typically a piece of cake to get rid of. And I use an ultrasound to inject in the knee so I can watch where the fluid is going. We would probably just use some PRP platelets. You might need a tune-up. As we age, things do wear down. I've done a few stem cells and platelets on my knees when they've had problems. I've done my shoulders, my elbows, my right wrist. I've had other people do my neck and back because I can't reach there. But all the stuff on the front of my body, I inject myself. Easy.
Very nice. I will definitely make an appointment with you, Doc. Thank you so much. God bless you.
All right. Thank you. God bless you, too.
Have a wonderful weekend.
Thank you, Omar. And the number to the office, if anybody wants to call for an appointment or get more information we didn't talk about, the phone number to the office is 800-300-9300. That's 800-300-9300. This is Dr. Marc Darrow. I'm a medical doctor. Our show is Living Pain Free. And if you want to talk to me live right now, I will mail you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What that means is grow the tissue back. Don't cut out tissue. Typically, when I look at surgical reports, let's say someone has a meniscal tear. They're going to cut out that tissue, okay? Then they're going to do what's called a cleanup. If there's any frayed tissue inside, they're going to cut that out too. What happens? The knee becomes unstable. You have immediate arthritis, even if there wasn't arthritis before. So I'm not for that. I have meniscal tears, medial meniscal tears in both of my knees. I had pain. I injected them. I have no more pain. I not only ran in the mountains yesterday morning with my husky, Bella. After work, I went down to the beach and ran there again.
So would you like to talk to Ray in Los Angeles?
Ray, Dr. Marc Darrow, how are you today? I see you have some low back pain. What's going on?
Can you hear me okay?
Yeah, you can scream at me, though. I won't take offense.
All right. I'm on, I pulled over. I'm on my cell phone. I pulled over to talk to you.
Good.
I wanted to talk to you about the lower back.
Okay.
I have a lot of issues. We could talk for probably hours about me and in particular, but the issue I want to talk to you about is my mom. She's 81 years old, and she's had a lot of lower back pain. She hasn't had broken vertebrae. It's mostly all disc inflammation, and she's a very vibrant person and very healthy otherwise, but she's gotten to the point where she's like, I can't travel anymore because I can't sit for more than 3 hours, so I can't take a plane, I can't come visit you. And she's been to doctors, they've done x-rays, they've done all their diagnostics on her, and they just give her rest, take ibuprofen. And I said, well, what about doing yoga and trying to strengthen your back, or is there anything you can do? No. She said, when I do yoga, I try to do exercise, then it inflames even more. The only thing I could really do is take ibuprofen for relief. Okay. And the pain comes up for her, and sometimes she's doing fine, and then an hour later she can't walk and she has to sit down. And
Oh,
it's
that's
gotten
sad. I'm so
bad.
sorry. Yeah. So let me tell you my hit on it. I haven't examined her. I could tell you in 1 minute if you bring her in what's going on just by touching and moving her. But from what you're telling me, it's not
Right.
her discs inflammation that are causing her problem. It's the enthesis where the ligaments in the spine are attaching to the vertebrae or to the pelvis. I see
Right.
probably 99% of the back pain I see is that. Even though they come in with these very seductive diagnoses where it looks like they need surgery. So
Right.
got to be careful.
I
Don't
wanna-
don't put a knife in. Once the knife is in, you can't really take it out. The damage is done. With what I
I'm
do,
not
it's
gonna
just
do-
simple injections.
Yeah, and I had a question for you about that. Now, so I wanted to come and visit us. I wanted to visit our grandson, and I told her I'll buy you a first class ticket. You can lay flat. I'll buy you
Yeah,
one of those.
that'd be
seats. Very
great.
expensive, but if I was to bring her out here, and she was to have some injections, I mean, is this something that has to happen? Does it take a month?
It's hard to say, Ray, how soon somebody feels better. That's the problem in everything. I can't predict. I know from studies that tissue starts growing on day 3 after an injection, so we know we're rejuvenating tissue. But when someone feels better is a whole unknown to everybody. I've had parts of me I've injected that have healed literally overnight, and some that have taken a while and a few times. So what I tell people, we have a lot of people who travel here from all over the world to get injections. I say, come in the first day you're in town. That way, if we need to do subsequent injections, you're here long enough to do that. And I'll give you an example. I had a gentleman from Georgia, South Georgia, come in, and he had what was called bone-on-bone knee arthritis. Bone-on-bone is a lot of BS, okay? It doesn't mean anything. Right. His knees were not bone-on-bone. He had a little cartilage loss. He was very overweight, which causes knee pain. We did 4 stem cells in a row, 4 days in a row, and he completely healed up. To this day, I hear from him once in a while, and he says his knees are still doing great. So that went from bone on bone, ready for knee replacements, to I'm doing great. Be careful. That's all I can tell people. Be frickin' careful, and don't jump into a surgery when you can do regenerative medicine. I'm not saying that regenerative medicine can heal everything. It can't. I always tell people, if you have a broken bone that's sticking out of the skin, you better get to the ER and have a surgeon there immediately. But most of these things that get operated on, in my humble opinion, should never be operated on. Causes more problems, maybe not right away, but down the road.
You're talking to a guy who's had 4 shoulder surgeries, 2 on each side.
Okay.
And bone spurs. I had a neuroma surgery where they just cut a nerve out. So, and left my foot partially numb there. But, so now I don't have pain, but now I can't feel a certain part of my foot.
Yeah.
So,
well, what I do for that is I inject it. I don't do any surgery for that. And all of those.
And I wish I could have. Inquired sooner, but for my mom, if I were to bring her out,
just set up an appointment. Set up an appointment the day she's arriving, and we'll have a talk and see if I can help her.
Oh man, I really, really appreciate it.
By the way, if you have trouble with my office getting an appointment when you need it, just email me through the website, which is www.jointrehab.com, and I'll call you and get you in when you need to.
I really appreciate it. Thank you, Dr. Darrow. Thank you for your expertise. Thank you for your caring for people and what you're doing. It's just a great thing.
Well, thanks, Ray. And I mean, you mentioned first your mom's back, and then your Morton's neuroma, and then your shoulder surgeries and all that. I work on all those things. There's no part of the body I don't inject. I'm not limited to like knees or backs.
I'd love to come in and see it for myself because I had 2 surgeries on the right, and then 6 years later I tore it again. And I went in, and the doctor said, we've done this twice, and A third time may not be good. You may need a shoulder replacement, but there's another surgery, and it's a newer surgery. And he says, we'll take a cadaver tendon and we'll tie it to your trapezius and wrap it around. And then
You know what? I'm going to be honest with you, Ray. You're making me absolutely sick and nauseated right now. I'm just being honest with you.
You're going to be proud of me because I didn't get that surgery.
Okay.
And my shoulder healed up minus the muscle that tore. I don't have a certain forward range.
Well, let me tell you something about muscle tears and tendon tears and ligament tears and blah, blah, blah. I have, in my right shoulder, I have a subscapularis tear. That's part of the rotator cuff. I have a supraspinatus tear, and I have a labral tear right around the joint. I have no pain in my shoulder. Zero.
Wow.
I did, but I self-injected. I injected it. It's healed.
And all of those tears that you're talking about are all the tears that they repaired and sewed. Now I have clicking and arthritis.
Well, repairing the tears didn't help.
No.
See, what I'm trying to impart to you, Ray, I've got those tears now.
Right.
What I did by injecting didn't fix the tears. It wasn't the tears causing the problem. I'm an athlete. You're an athlete. The body gets beat up. Those tears are normal.
Right.
It's like if you're driving a Ferrari and you're hitting the gas, what happens to the tires?
Absolutely.
They wear down. Does that mean you throw them away? No. You can, back in the day, what did they call it? Retread the tires. That's all we're redoing is retreading the body. We're re-stimulating new tissue to grow and heal and get rid of the pain that way.
Let me ask you one other important question, and I appreciate your time. I have arthritis from these surgeries. Do the injections help arthritis at all, or is that a condition?
Absolutely. I get people with arthritis all day long that get better.
Wow.
And I'm glad you said that. You have arthritis from the surgeries.
Oh, yeah.
I see it every day. Person did not have arthritis, they get a surgery, then they have immediate arthritis because tissue is taken out. I mean, arthritis, by its terminology, arth is joint, and itis is inflammation. Now, there's a whole bunch of different types of arthritis, but that's traumatic arthritis.
I'm hearing you loud and clear, and I'm definitely going to come and see her because I just recently had a surgery on my left thumb, and it had been bothering me for a couple of years, and I knew there was a torn tendon on the inner part of the thumb knuckle. So I went in, and I went to 3 different doctors because I really wanted to make sure I had the right opinion.
Sure.
And they said, yeah, you have a tear. And they said, this is old. When did you do this? I said, I did it a couple of years ago. I had a tear in there, but I had arthritis in the joint and a bone spur.
Okay.
So this doctor said I pioneered this surgery, and he went in, and he repaired he strengthened the tendon by putting some anchors and using some of the tissue in there. He strengthened the tendon. He said, the arthritis you may have to live with, that's never going to go away.
No, that's not true. We can help. I take care of finger arthritis almost every single day.
And it's interesting because I asked him, and he is probably considered top surgeon, world class, does all the top athletes. But I said to him, what about injections? I said, I'm sorry, what is the term you use for the injection? What's it called?
Well, PRP is platelet-rich plasma, and then stem cells, depending how severe the situation is.
What about PRP or doing some injections? And he just went, nah.
But that's his training. That's his religion. Do you get that?
Right. And
I was trained in surgery, and I jumped ship because I didn't like some of the side effects that people got. And I learned regenerative medicine.
He didn't even consider, it might work. It's worth a try before I cut. But then I guess.
Well, we're at the end of the show. God bless you, Ray, and everyone else. Nita, Suzette, Alex, and the crew. And I'm going to give out my phone number to the office. Write it down. It's 800-300-9300. Email me through the website at www.jointrehab.com. I would love to hear from you, and God bless you all.
Thank you, everybody. We'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.